we can dig in a little bit on some of the stuff that we're talking about, some of the signs and symptoms that people can recognize either in yourself or in others. One of the most significant indicators are helplessness or hopelessness. So there are such statements like, I don't think life's worth living. I don't think it would make any difference if I weren't here tomorrow. People will verbalize that, and it's important as a support person to recognize those cues. What are some other signs and symptoms that you teach
hit
about?
a big one there. I mean, how many people hear their son or daughter say something like, well, you're not going to have me around much longer, or I wish I was dead. And most of the time.
Or no one would care
yeah,
for it.
Nobody, 95% of the time it's out of frustration. But how we respond to that when we hear that as parents, as teachers, pastors, people who work with young people, you hear a young person make that, how you respond. By not responding, you're responding. They're talking to you about their envisioning life without them here. How do we, so it's important we take those opportunities, just by your example, to say, wait a minute, did you say you're not important, that nobody would miss you? Let me tell you what you mean to me. So we have to respond to those. But really, very quickly, some others. Previous suicide attempts. You would be amazed at how many times that we're involved in, and regretfully after a suicide has occurred, that it was not the first attempt. And sometimes the other attempts are known by a lot or a few people, and it hadn't been shared. If you know someone who made a suicide attempt, even if it's one of those, which I hate the word, half-hearted suicide attempts, you have to make sure you contact someone. If you're a friend or if you're a parent, contact someone and get help, because a previous suicide attempt is a big indicator. And I know you're going to talk about depression.
So the depression piece is a significant factor with suicidality and is often associated with suicidality. So it's important for people to also understand signs and symptoms of depression, either themselves or their children or loved ones, to kind of track that, because oftentimes escalating depression symptoms can come before suicidal ideation. Some of those symptoms are change in appetite, an obvious one, crying spells. But if you notice someone crying more than usual at home, it's worth investigating, looking into. Change in sleep, staying up all night or wanting to sleep all day, one or the other, weight loss or weight gain. Those all can be indicators of an ongoing depression that might not have an emotional component yet, but the body or the brain changes are already happening. That's when it's time to look into getting some help. You can start with a primary care doctor, a school nurse, just to sort of look into that a little bit more. But those can be significant predictors of ongoing serious depression, which can lead to suicide.
Yeah, depression is a tough one for me. I always say when I get to do speeches on it, it's so tough because it does manifest itself in different ways. Some people who are depressed eat everything that doesn't get out of their reach. Others won't eat at all. Some sleep all the time. Others don't sleep. I like to use the phrase out of character behavior. If a person is acting out of character as you know him or her to be, does it mean they're suicidal? No. It means there's something going on in their emotional or mental health that has caused a change enough for you to notice it. So if you notice it, you need to first talk to the person about what you're seeing. If you're not satisfied with that answer, then it's the time to reach out to your primary care doctor, the pediatrician, the school psychologist. There's some things I'm concerned about. I've talked to them, and I'm taking action, as we talked about. That's the key to this whole deal. Learning some of the things that could help you more easily recognize some of these signs, but then to take action.